This next brief scenario, what my purpose with these was to give you the opportunity to learn the diagnosis and the procedure coding. So we have a patient with persistent pneumothorax. That's our diagnosis here. This patient undergoes pleurodesis with the installation of talc into the pleural space. All right. So we need to know what a pleurodesis is. Now, in our course, we learned medical terminology. Do we remember everything? No. As time goes on, yes, it becomes more and more familiar. But until you're familiar, you want to use an online dictionary, or honestly, you can use in CPT. I did want to ask this because I'm not sure. I know that you have the common language description in your ICD-10 CM. Do you all have the common language description in the CPT as well?
Yeah.
Okay. Okay. So what a pleurodesis is it's a procedure which involves putting an kind of an irritant drug, which is the talc in this case, into the space in our pleural cavity between the lung and the chest wall. And this is a lot of times to fight the infection, in this case, the pneumothorax. All right, so I want us to look up how to find these codes in our CPT. We're going to first go to pneumothorax, which there again, we did very well on this. Oh, I don't know why I went there. I'm going to go to my index. And when I type in pneumothorax, I'm not going to see the word persistent, but we've learned that persistent is a synonym with chronic. So we're going to assign our J93 because none of these are applicable. Okay. It does not say spontaneous. Our J9383. It says persistent, which is equivalent to chronic. J93.81 is our diagnosis code. Okay. What about the pleurodesis? Okay, what am I getting when I pull up pleurodesis?
Pleura.
I'm not getting anything in here. I want to make sure. All right, so I'm going to have to figure out what this is, where I'm at here. Am I not? Anybody want to tell me where to go? Eugenia?
Okay, so plural, that's what I typed.
All right, if I go here, which she is correct, I'm going to see the pleurodesis.
Yes.
What I want all of you, and I believe, and you know this, but it's so easy to forget this. In CPT, it's not always that you can enter the procedure. You must sometimes enter the body part that is being, that's the objective of the procedure. So you want to remember that, because when you're pulling up the pleurodesis, you get absolutely nothing. But if you pull up where the procedure is being performed, which is in the pleural cavity, and I could have pulled up pleural, and I get pleurodesis, I'm going to find my correct code. So let's pull this up. Both of these are the same code, which is our correct code. And we can see here that this is installation through a chest tube through a catheter, an agent for pleurodesis. That is your talk right here. So we're good. We know that we have identified the pleurodesis, the instillation of the talk into the chest wall cavity, the pleura. And do you know, I'm looking back, every one of you got that. So we are covering things that you got all 100%, but we want to make sure that we cover all these in case you had any questions as you were trying to find the answers as well.